So while there hasn't been a monumental shift in the world of CME over the last decade, there certainly have been some subtle changes. Online platforms have certainly become more sophisticated as the importance of active versus passive learning has taken hold. Educational activities are becoming shorter as the CME community has correctly realized that no one has the time or patience to passively sit through a 60 or 90-minute slide presentation on the latest and greatest in disease state X. There used to be quite a few providers who would simply set up a camera team to film a live symposium and then slap that up on their website as an accredited enduring activity. That's something you're seeing less and less of these days, and I think it's been a good trend for the CME community. CME certainly continues to be a data-driven field. The old emphasis on the more butts and seats, the better that we're doing, hasn't entirely dissipated, but there is now much more of a need for quantitative and qualitative assessment of learning. So then what does all this mean for the medical writing community? Well, for starters, it means that there is more demand for our services. Fewer canned presentations and faculty-derived slide decks means more need for unique content. Many online platforms have robust capabilities that require the development of varied kinds of testing questions, robust interactive case studies, video scripts, and other kinds of materials. It's the nimble medical writer who can adapt to the changing ways that CME is being delivered who is going to succeed today and in the future. So then what does the near-term future look like in CME? Certainly some of the recent trends we've seen are likely to continue. The COVID-19 era has shifted pretty much all education online, and providers are being forced to think more creatively about the best way to educate the community of clinician learners. More online education works in the favor of medical writers since it's much more difficult to lean on faculty to create robust materials for today's learning platforms than it may have been to have them put together a slide deck for a live presentation. Instead of expertise in specific therapeutic areas, there are some smart medical writers who are marketing their expertise working within specific online complex learning platforms. They're promising fewer headaches for their clients who work with them within these platforms because they know what needs to be done, what kinds of materials need to be developed. And as we all know, a happy client is good for everyone.